What the f are you doing calling me at 3:47 a.m. after I just worked a 16-hour shift? This better be Game of Thrones Season 4 Episode 2 good, or you'll never hang another IV in this town, sweetheart. These are the last words we want to hear when we call a doctor in the middle of the night and we're not absolutely sure if we should or not. Now, teaching someone how to not be a is a lot more difficult than teaching you how to respond to it, because that's what truly matters. What also matters is that you have all your ducks in a row when you make that call. Now, let me preface this with, if there is an actual emergency, then a code, a rapid response, or whatever's applicable to the patient's condition at that time should be called, then the doctor is notified. So, assuming you've got the time, I'm going to give you part 1 of the 10 best tips for you so you can pick up that 1,000-pound phone, especially at those odd hours of the night. Alright, let's get into it. Number 1, check your orders. If you're worried that Mr. Prostate has some lower belly pain, hasn't peed in 24 hours, you bladder scan him to find a full 24-pack of hospital cranberry juice in there, you might be surprised that when you peruse through those orders, you'll find something that reads, straight cath for signs and symptoms of urinary retention, leave in Foley if bladder scan yields more than 500 cc's. Boom! No doc needed. That's why they write those standing orders, so they could sleep and feel fresh for their stressful life as a hospitalist the next day. So you catch him in the morning and say, yo, Dr. Sleeping Giant, Mr. Prostate over in 504 had a vat of Diet Cran in his bladder, so I popped the Foley in, left it in there because I think he might be retaining. You just recognized the problem, found the existing order they wrote for that situation, and addressed it on your own. You for sure scored some nursing points for not waking up that doctor that was probably dreaming of a world with more nurses just like you. But you look, no orders. Now what? Number 2, run it by someone else. Okay, you're concerned about a patient. Part of our job. Knowing everything, not part of our job. Grab your charge nurse and say, hey, do you mind if I get your thoughts on what's going on with my patient over here? I'm not too sure what's going on with this, that, or the other thing. Let's say your charge ain't the sharpest 20 gauge in the bin. Ask that nurse you really trust him for a third set of eyes. If you all decided it's not necessary to page the doctor, document your concern and discuss with charge nurse and genius know-it-all RN. That's not to throw anyone under the bus if something goes wrong, okay? That's to show if in the off chance it went to court, there is proof that 3 qualified licensed nurses discussed the situation and deemed the call not necessary. Otherwise, I think we should call. Number 3, vitals, vitals, vitals. Now, I'm no clairvoyant, mind reader, or fortune teller. Got me now! But I can promise you, no matter what provider you call, it doesn't matter which floor, which specialty, or if Mercury's in retrograde or not. They will all ask the question, okay, what are their vitals? I can't tell you how many times I overhear nurses on the phone scrambling through the chart trying to find the last set of vitals, and they're from 4 hours ago. If time warrants it, you should have a fresh set of vitals including pain, patient behavior, and a focused assessment, okay? And take a look at how they've been trending, right? These are things that you should have in your brain before trying to put them into someone else's brain that might have just woken up. Side note, if the vitals have been trending down and you didn't notice, don't not call because you're worried you probably should have called sooner, okay? That's backwards thinking. That's putting your own risk of looking incompetent before the patient's safety, which in turn will make you actually incompetent for not addressing the issue when you recognized it as an issue, okay? Whole body's nerfing. What's important is you caught it when you did, don't let it go any longer. Number 4, have other results ready. Vitals are called vitals because they're vital. You should know this patient's last set of vitals off the top of your head, but aside from that, you might have 6, 8, or 10 patients that night, so no one expects you to know each and every one of their lab values or detailed radiology reads. Pull up the labs, pull up the imaging reports, highlight and mention anything that's out of the normal range. That way, when they ask about a particular lab value, scan, or a study, you'll have it right at your fingertips ready to fire back and help the process go much more smootherly. Much more smoothly. That was not smooth. Number 5, pull up the MAR, the medication administration record, okay? You may not be expected to know an entire comprehensive metabolic panel off the top, but when you tell them that the patient's stomach's distended, there hasn't been a bowel movement charted since admission, and the patient says it's been days since they went boo-boo, they're gonna ask if they've been getting opioids, they're gonna ask if we tried laxatives, stool softeners, and suppositories. It's not to stump you. It's because we all recognize there's a problem, they're a doctor, they need that information to fix it. Over the phone. This is especially true if they're the on-call doctor. Now, I'm no doctor, nor do I play one on TV, but I get messages in my inbox all the time from strangers across the world, okay, and they read something like this. Pull it up. Oh my God, you're so hot. Will you have my babies? Will no, wrong one. Come on. Hello, okay. Hello there. My grandmother is suffering from blah blah. and you seem to be an expert in the field. Can you advise? Yo, I'm sorry about your grandmother, but A, I'm not an expert in that field, and B, someone's gonna need a lot more information than that on Gam Gam to give any advice. And I'd still consider not giving the advice because I just don't know, because I have no idea who you or your grandma are. Clear enough? Okay, this is for you Generation Zers out there just getting your feet wet in the field. Imagine some cute guy or gal at Starbucks somehow got your number in the tip jar, and a week later at 3 a.m. they call saying, "Hey, I'm sorry to wake you, but my partner and I are fighting and I just don't know what to do." Now, it may be in your best interest to counsel them through their inevitable breakup and the directions to your place, but if you're a stand-up guy like your boy, you're gonna need some basic info at least before you make an informed decision. Now, the difference is you could think, okay, this barista is clearly not stable, and hang up. But our on-call doctors can't. Okay? It's their obligation. They don't know anything about Extra Whip or their boyfriend, so very succinctly tell them who you are, what's going on, what you've done to try to resolve it. Could be nothing, could be the wrong thing, but it's the information they need to decide what potentially life-changing decisions they're gonna make for this stranger. It's not always an easy call for them, so help them out. Yay! Stay tuned for the other 5 extremely important tips you need to know before phoning that physician like a pro.